Welcome to A&P Live Studio. I'm your host. As a registered nurse and an anatomy and physiology instructor, I create these sessions for advanced healthcare students and professionals, just like you. Today, we're going to explore one of the most fascinating phenomena in all of neurology, callosal disconnection syndrome, which you might know better as split brain.
So, let's begin with a patient. Let's meet Mrs. Reyes. She's 72, and she's in recovery from a recent stroke. Her family is getting worried, though, because of something strange that's been happening. As she gets dressed, her right hand will very carefully zip up her jacket. But then, her left hand comes along and immediately unzips it. You can see the frustration on her face. It's like her own hand is working against her. This isn't just post-stroke confusion. It's a profound neurological puzzle we're going to solve together.
To really understand what's going on with Mrs. Reyes, we have to start with the basics. We need to review the brain's normal blueprint, because you can't really grasp the pathology until you have a solid handle on the normal physiology. Okay, so we all know the cerebrum is split into two hemispheres, but they aren't just mirror images, they're specialists. For most people, the left hemisphere is the logical one. It handles language, analytical thought. It's kind of like the brain's in-house narrator. The right hemisphere, on the other hand, is the artist. It's brilliant with nonverbal things like spatial relationships, reading faces, and processing emotion. They have very different jobs, but they're absolutely designed to work as a seamless team.
So how do these two experts, the speaker and the artist, collaborate? Well, they do it through the corpus callosum. This structure is a true marvel. It's the largest bundle of white matter in the brain, essentially a superhighway made of 200 to 300 million nerve fibers. It's the critical bridge that lets the left brain know what the right brain is seeing and feeling, and vice versa. It's what creates our single unified sense of consciousness. And that brings us right to the heart of Mrs. Reyes' problem. What happens when that critical communication bridge gets damaged? This is where our tale of two separate minds really begins.
The corpus callosum can be damaged in a few different ways. Most commonly, it's a vascular event, like the ischemic stroke Mrs. Reyes had, or a brain bleed. But other things can do it too, like brain tumors that grow right across the midline. You'll hear them called butterfly gliomas. Multiple sclerosis, a serious TBI, or even a deliberate surgery called a corpus callosotomy, sometimes done for severe epilepsy, can also cause this disconnection.
No matter what the cause is, what's happening at the tissue level is the same. A physical break in these myelinated axons. It's literally like taking a pair of scissors to millions of communication cables. The individual hemispheres might be perfectly fine, but the information they're processing is now stuck. It's isolated. This complete loss of communication between the two halves of the brain, that's the core defect here.
So when you have this profound disconnection, it shows up as a set of really unique and, frankly, bizarre clinical signs. We're now looking at the real-world effects of having two hemispheres that are forced to work alone.
The most traumatic sign, and the one that explains the jacket incident with Mrs. Reyes, is alien hand syndrome. It sounds like something out of science fiction, but it's very real. Patients find that one of their limbs, usually their non-dominant hand, starts doing complex things all on its own, purposeful things, but without the patient's permission or intent. It's a complete break between what the patient wants to do and what their hand is actually doing.
Now, it's really important for us to know that alien hand syndrome isn't just one single thing. How it presents totally depends on where the lesion is. If the damage is in the anterior part, you get frontal AHS, where the dominant hand might compulsively grab things. A lesion in the middle, like Mrs. Reyes likely has, causes callosal AHS, and that's where you see that classic conflict between the two hands. And if the lesion is in the back, you can see posterior AHS, where an arm might just float up on its own.
Another classic sign is something called tactile anomia. Let's just walk through it together. Imagine you place a simple object, say a key, into the patient's left hand, and their eyes are closed. Okay, so that sensory info about the key goes to the right hemisphere. Normally, a signal would instantly cross the corpus callosum to the left hemisphere's language centers, but here, that bridge is out. The information is trapped, so the right brain knows it's a key, but the left brain, the one that talks, is clueless. Ask the patient what they're holding, and they'll say, "I have no idea." It's fascinating.
And other symptoms follow that exact same logic. You might see left agraphia. The person can't write with their left hand because the motor commands from the left hemisphere just can't get across. Or left ideomotor apraxia. They can't follow a command like wave goodbye with their left arm. It all comes back to that same core problem, trapped information.
So, how do we actually confirm what's going on and start helping patients like Mrs. Reyes rebuild these connections? It's not just about seeing the damage. We need to see the functional result of that damage.
Modern imaging is, of course, absolutely crucial.
A standard CT or MRI can show us the lesion, the area of the stroke, for instance, but there's a more specialized technique called diffusion tensor tractography, or DTT, that gives us a much clearer picture. It actually allows us to visualize the white matter tracts themselves, so we can literally see the broken fibers of the corpus callosum and confirm exactly where the disconnection is.
Now, a diagnosis like a severed connection in the brain sounds pretty devastating, and it is, but it is not the end of the road. The brain has an amazing ability to adapt, and treatment is all about tapping into that potential.
There's no one-size-fits-all cure, so we use a multidisciplinary approach. Things like mirror box therapy can use visual tricks to help the brain remap a motor control. We can use strategies to retrain the hands to work together again. Verbal cueing helps the patient use their intact language centers to consciously direct their rogue limb. And of course, CBT is vital for helping them cope with the stress of it all. Sometimes, medications like clonazepam can help reduce some of the involuntary movements.
So what's the physiological principle that makes any of this work? It all comes down to neuroplasticity. The brain isn't hardwired like a computer. It can physically change and reorganize itself after an injury. All these rehabilitation therapies are designed to encourage the brain to form new connections, to find new routes for information to travel. It's about helping the brain build its own detours around the broken bridge.
All right, let's bring everything together now. We'll do a quick systems integration and then summarize the key points from our exploration of callosal disconnection.
So obviously, the main problem is in the central nervous system, but the effects ripple outwards. The muscular system is heavily impacted, right? That's the motor control problem. The integumentary system is also involved. The nerves in the skin are working fine, but the brain can't properly interpret the signals they send, which is what we saw with tactile anomia. It's a perfect example of how one focused injury in the CNS can throw off whole body function.
So, to quickly recap the whole story, we start with the normal brain with the two hemispheres in constant communication. Then some kind of injury severs that connection. This traps information in each hemisphere, leading to those bizarre signs like alien hand syndrome. And finally, our treatment strategy is to use targeted rehab to harness the brain's own power of neuroplasticity to build new compensatory pathways.
And this whole topic leaves us with a truly profound question, one that's almost more philosophical than medical. Studies on these patients have shown that each hemisphere can perceive, learn, and have intentions all on its own. So it really makes you wonder, is that feeling we all have of being one single unified self just an illusion created by the constant high-speed chatter across the corpus callosum? Something to think about.
As always, please remember that this presentation is for educational purposes only. It is not intended to be medical advice, a diagnosis, or a substitute for decisions made with a professional healthcare provider.
Thank you so much for joining me here at AMP Live Studio. Stay patho-curious, and I'll see you in the next session.